There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.
Good morning. I want to welcome you to our press briefing with updates on COVID-19. Before we begin our press briefing today, I'd like to ask you to join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. We will move directly today. The mayor, the chairman are not with us today, but we are very fortunate to have with us today our representative from Phoebe Putney Memorial Hospital to bring us an update from a hospital perspective where COVID-19 is concerned. And we have the Chief Medical Officer for Phoebe Putney Memorial Hospital, Dr. Kathy Hudson, is with us today. I'd like to bring Dr. Hudson forward now for some remarks.
Good morning. So the good news is it looks like we're on the backside of the Delta variant this summer. Our numbers do continue to decline. However, they're still relatively high compared to our non-surge times. The community still has COVID being spread, although the positivity rate is decreasing. And September has been our third highest month of the pandemic since we began averaging our monthly averages. So today there are 79 patients in the Phoebe Health System with COVID, 62 in Albany, 17 in Americus, and there are 0 patients in Sylvester at Phoebe Worth. This is the first time that has been the case since the first week of August. So we still continue to have a high number of patients in our COVID ICUs. We have 30 in our health system. 23 of those are on ventilators. And I'm sorry to say that 11 people have lost their life at Phoebe Putney this past 7 days due to COVID. Since July 15th, we have admitted 977 patients with COVID. The average age is 55. 57% of those are younger than age 60. We have admitted 6 patients aged 10 and under, and we've admitted 17 patients under the age of 20. So during this time period, 52% of our patients have been women, 50% are African American, and 46% are white. I'm sad to say the vast majority are unvaccinated. 87% of our patients in the hospital with COVID-19 are unvaccinated. So of course, vaccination continues to be the best prevention of hospitalization due to COVID. Our healthcare workers have been stretched very thin as throughout this last surge. And so we've done, and I've talked about it before, where we instituted something called Helping Hands, where we brought in non-clinical personnel to help the clinical personnel take care of patients. They have been of a tremendous help answering phones, running errands, getting supplies, helping turn patients with COVID because they're so debilitated. So luckily, as this surge is beginning to come down, we've been able to kind of begin phasing out our Helping Hands. They worked over 4,500 hours in 13 different departments and units throughout this time. So they've been a tremendous help. Some of our clinical Helping Hands will continue to help provide care, but the non-clinical Helping Hands will be phasing out, going back to their regular duties. Luckily, our staffing has gotten better, and we've been able to do this. Several weeks ago, during the worst part of our surge in early August, we discontinued a lot of our elective surgeries. And then it progressed that we discontinued all elective surgeries, and we were only doing surgeries that were urgent or emergent. And as our numbers have come down and our staffing has improved, we will be opening up elective surgeries again later this month. trying to catch back up into our day-to-day life. So we are still treating patients with monoclonal antibodies. That's still an option. So if you are diagnosed with COVID-19, the monoclonal antibodies administered early in your illness will prevent progression to the severe illness and possible hospitalization. It's not the, it's not the first choice to treat COVID. The first choice is get a vaccine, don't get COVID. So you can schedule the monoclonal antibodies or the vaccine by calling 229-312-MyMD. We are administering both first dose, second dose, and the booster shot of the COVID-19 vaccination. And so if you do qualify, please, make an appointment with Phoebe, go by the drugstore, call your primary care physician. There are multiple options to get vaccinated. Our mobile wellness units are still out providing that service as well. And to remind everyone who qualifies for the booster shot with Pfizer, anyone over the age of 65. If you're over the age of 18 with comorbidities, it puts you at higher risk for severe COVID infection. Or if you're over the age of 18 and your job puts you at risk for exposure, which of course is healthcare workers, public safety workers, just about, if they're grocery store. So again, please reach out to get your vaccine. I also want to remind everyone of the flu vaccine. Flu season is on its way. Last year we had a very light flu season, and expectations are this year that we will not have a light flu season, so please get your flu vaccine as well. It's widely available in any of the drugstores, your primary care physician, so COVID vaccine, flu vaccine, and be safe. Thank you.
Thank you, Dr. Hudson, for your report this morning. We will now move to hear from our representative from the Department of Public Health, Dr. Charles Ruiz, who is the director of the Southwest Georgia Public Health District, is here to provide an update. Dr. Ruiz.
Good morning. This pandemic is not over. People in Dougherty County and surrounding areas are still getting sick with COVID-19 infections. People are still being hospitalized, and people are still losing their lives to COVID infections. And it's really sad because most of these infections and most of these lives lost could be prevented. We have great vaccines that are available. While they're not absolutely perfect, they do provide great protection for most people. Even for those folks who get vaccinated and get the infection, it's usually much milder than it would have been without the vaccine. The vast majority of people who are requiring hospitalization and the vast majority of people who are losing their lives are those who are unvaccinated. I am pleased to say that in Dougherty County, every week we have more and more people who have decided to give vaccines a try. Currently, 49% of those who live in Dougherty County are vaccinated. 43% are fully vaccinated in Dougherty County. So those numbers are getting better. In the state of Georgia, 55%, well over half of Georgians have had at least one vaccine, and 48% of Georgians are fully vaccinated. We have noticed that over the last 2 weeks, there are 451 brand new cases of COVID infections among Dougherty County residents. And that's about 32 new cases each and every day. So the infection is still in the community. There's still danger around us. Vaccines are available in many locations, including the local health department. In fact, every health department in the state of Georgia provides opportunities to get vaccinated. I do want to talk about one special event. This is partnership between an organization known as CORE. They provide vaccination services. It also involves the folks of the Mount Zion Church. And on this coming Monday, October the 11th, there will be a vaccination clinic offered at the old Mount Zion Church, which is located at 1905 Martin Luther King Jr. Drive here in Albany. This clinic will be done outdoors. You can drive up and get your vaccine. Pfizer and Johnson & Johnson will be offered there. The time will be 8 a.m. to 1 p.m. And we have $25 incentive cards which will be given to people who get their first or second vaccine shot there that day while the supplies last. So if you're out and about this coming Monday between 8 a.m. and 1 p.m., if you're not vaccinated or if you know someone who's not vaccinated, please consider going and getting that vaccine at the old Mount Zion Church. Testing is available 7 days a week, and I do want to go over this schedule because we have a slight irregularity coming this Monday, October the 11th, because of the holiday. Today, the PCR tests are available at the usual Oak Ridge location that's near the intersection of South Slappy and Oak Ridge. They are there today between 9 a.m. and 4 p.m. And tomorrow, Sunday and Monday, testing will take place at the health department on South Slappy. And then starting Tuesday for the remainder of the week, it will be back to the Oak Ridge site. So PCR tests are available 7 days a week. If you feel that you need to get a test, please come. It doesn't cost anything. And we just want to urge everyone to take precautions. Social distancing can help prevent the spread of infections. Wearing masks, keeping your hands and hard surfaces clean can help, but nothing helps any more than getting a vaccine. Be safe. Thank you very much.
Dr. Royce, thank you for being here and providing an update today. I will now move and hear from Dougherty County's coroner. Mr. Michael Fowler is here to provide an update. Mr. Fowler.
Good morning. My presentation will be today. We have 357 residents in Dougherty County that have passed. We average one a day that's dying from COVID-19. I know the hospital said they had 11 deaths in the last 7 days, and some of those deaths were from out of town, but 6 of those deaths are here in Dougherty County. So I want to encourage you to still practice social distancing while you're masked. This is a great weekend coming up. I know we have Albany State homecoming. We have the parade. They're going to be tailgating. They're going to be family, friends, classmates, guests coming to town. We're looking to have a great time this weekend, but we ask you to practice social distancing, wear your mask. The ones that come, we're going to have thousands of people to come to town. We don't know where they're coming from. We don't know what they may have. If you don't know, if they're not living in the household with you, and you're going to be on a crowd within 6 feet, you need to wear a mask. Like I said, you don't know where they've been or where they're coming. Have they had the vaccination or not? We hope that you have had the vaccination. We're encouraging you to get the vaccination. And there are going to be sites this weekend that you can get the vaccination, but still, if you haven't already taken it and had it for the last couple of weeks, then you need to wear a mask around the individuals that you're going to be around in the parade, at the tailgating. I mean, I want you to have a great time, but I want you to be safe. We don't want to wait 14 days after this homecoming weekend and we see a surge again. So we asking you to be safe. I want you to have a great time. And we also asking you, we know drugs out there and people are going to be bringing drugs to town, but we know there's another problem here. We have had so many drug overdoses in the last few weeks, so you got to be careful about that. We asking you, we want this to be a great life, great city, And we don't want this to be the murder capital of the world. So we ask you another thing, put the guns down. Let this be a safe place this weekend. I love to go through this whole weekend that we did not have a shooting. I love to go through this weekend that people did not overdose this weekend. And I love to go through this weekend and the next 14 days that we don't have a surge from COVID-19. Again, be safe.
Thank you, Coroner Fowler, for your update today. I do want to, before we end today's press briefing, I do want to mention that Dougherty County, through its Strive for 75 campaign here in Albany and Dougherty County, the Strive for 75 campaign, and we've talked about it, do your part, reconsider, get the shot. Well, October 16th, mark your calendars now, October 16th, there will be a second incentive-based vaccination event. You know, the first one was a big success. We had an opportunity to get out and see many people from Dougherty County that came over and received either their first vaccination or their second shot as well. The Pfizer product will be available. We'll be administering Pfizer, but it is an incentive-based event, again, behind the Civic Center, October 16th. $100 Visa gift cards will be given to those who come, who live in Dougherty County, who reside here in Albany and Dougherty County. You come and get your first or second shot, $100 Visa gift card. We had a great time seeing you and vaccinating people throughout our community. Sam Allen was there. He's the director of the Dougherty County EMS there, and I'd like to put him on the spot here just for a moment to come up just briefly and just talk about the event, the tremendous outpouring of people we had and those who were vaccinated. I think went over 500 people vaccinated there. And I'm going to ask Sam Allen to come up for a moment as we prepare for next Saturday's event. Director Allen.
Thank you, Chief. I appreciate that. As Chief said, we had a huge outpouring of people that came out on the first event. In 5 hours and 15 minutes, we gave 538 vaccines. That's roughly 102 people per hour that received the vaccine. 493 of those 538 were first-time vaccines. So we're working on the next event. We've doubled the size of the drive-through tent to help cut down on the wait time that some of the people experienced previously. We're going to have more inoculators on site. We're also expanding the site area where people go and collect their $100 gift card from Dougherty County. Again, those are for Dougherty County residents. If you live in Albany or Dougherty County, present your ID showing your residence. You age 18 and above will be eligible for the $100 gift card. Children age 12 and up are eligible for the vaccine. We'll be giving Pfizer and Pfizer only at this event. So children, you can bring your children and get them vaccinated also. Right now we're not able to do any under age 12, but 12 and up, we can give the Pfizer vaccine. We encourage you, please. The holidays are coming short. You've heard the information today from Dr. Hutchinson, from Dr. Ruiz, Chief Scott. The numbers are slightly coming down on the good side. Let's keep it there. Let's get vaccinated before Thanksgiving gets here and Christmas gets here, and we go back in January where we were last year. I'm really afraid if we hit that this year, the numbers are going to be really astronomical high. Please get your vaccine now. We'll see you at the Civic Center next weekend. Thank you.
Am I excited? I'm excited because I remember a time in our community when there was no vaccine, where testing was just getting off the ground. There were long lines for people testing. So I'm excited today about what I've heard today. The opportunity for people to be tested for COVID-19 is plentiful throughout our community now. You can get a vaccination. If you want a vaccination, you can get one now. And then excited again that next Saturday, you have another opportunity to not only be vaccinated, but receive a little gift as you leave. $100 Visa gift card to come and be vaccinated. It will help you help your community. So we ask you, as part of Strive for 75 again, we ask you, do your part, reconsider, get the shot. With that, that ends our press briefing for today, and we'll see you here at 10 a.m. next Friday. Thank you so much.
There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.